Happy Tree Friends, number 4 coming in for the kill, literally. Before we break down all of these injuries, my name is Dr. Jordan Wagner. I'm an emergency room doctor. If you find this video helpful, please smack that subscribe button and turn your bell notifications on. That way you learn when I post a new video. All right, let's dive right in. Uh-oh. Broken jaw on the toilet. Oh, drowning? Oh, that is crazy. What a horrible way to go. Could that actually happen? I mean, if there's enough force and then the impaled object is sharp enough to penetrate the tissue, yeah, that could happen. Now, the question is, to all of you, do you pull it out or do you leave it in? Leave it in. Get to the hospital ASAP if the person is still alive. Mr. Pickle did it. Oh my gosh. This happens in real life, call them open globes. Sometimes we can tell right away, it's obvious. Sometimes you can't. And you actually put a little stain in the eye called fluorescein. You see it kind of streaking out, which means that the aqueous fluids of the eye are actually coming out, just depending how deep it is. Oh, I don't think a card can cut the head in half though. Come on, that's crazy. This show is brutal. Oh, vacuuming up an olive and the pickle. And that was stuck, obviously. Right in the face. What's gonna happen? Oh! Yes! It doesn't even make any sense. What? Does the eye come out of the socket that easy? No. Okay, it's attached by the nerve and then 6 muscles and then you have different ligaments. For us to even get the eye to come out in an emergency, we have to cut the ligaments on the side that are keeping it in. He's a magician and he needs an assistant. He's gonna cut him in half. Zoop. Did. Who saw that coming? I saw that coming. Knowing these guys. You got intestine that is depicted by the strings. And then you can see some ribs under there. Oh. At least they called the ambulance. You're going to the hospital. Yeah, the patient's flatlined. Oh, back alive. Nice. If somebody's flatlined, they're not just gonna have them in the back of an ambulance doing nothing. If somebody's flatlined, that's asystole. No electrical activity, you need to be doing CPR. Asystole is not shockable. Standard protocols is epinephrine, chest compressions, epinephrine, chest compressions. The heart is not beating, so you gotta do anything you can to get the heart restarted. Oh, of course. What the heck? Ride those intestines. That is horrible. What the heck is going on here? Come on, oh my gosh, they finally made it to the hospital. Intestines are, what do we say, 20 feet long, but the intestines are attached by a mesentery. It doesn't just come out in like a nice long string. They are kind of stretchy, and why are they stretchy? It's because they're a muscle. We have skeletal muscle, which is the muscles that we have for like lifting weights and looking good. Then we have smooth muscle, which is blood vessels, organs, intestines. Oh, I hate when that happens. Oh. A lollipop to the eye. Oh, there goes the eye. I wonder if you can still see. Oh my gosh. Don't panic. Most eye injuries are penetrating eye injuries, lacerations, not eyeballs coming out and having this conundrum of an issue to where it's wrapped around the tree. It could be depicting the optic nerve. It has to do with our vision, connecting our eye to our brain, and so you don't want to mess that up. Definitely not sterile anymore. If you only have one eye, you actually don't have the ability to have depth perception. The other issue is if you have any brain lesions, sometimes we'll actually have double vision, 2 objects over top of each other, one that's moving away or you just can't see, or specific areas of the field of vision that you can't see. So sometimes people can't see on both sides or in the middle. It all has to do with where on the optic nerve injuries occur and if it's also on the optic chiasm, deep within the brain. Oh, there's a bird. Get a peck at it. Goodbye, eyeball. Yep. Oh, no. Oh, there it is. Oh, Wow. Eye itself coming out the other side. Very funny depiction. You have the brain that's coming out as a whole. You get the eye pulled out and you're pulling the nerve all the way, that goes all the way to the back of the brain. It'd probably be more stretchy. As I said, the nerves of our body actually look closer to like polyostringhes. Very white, stringy. It's really interesting that the information that we receive in our body gets transmitted in these types of tissues. Oh no, he's all cranked out on his brain on sugar, and now he thinks, not doing anything at the moment because they're not connected to anything. But what the heck just happened? Oh my gosh. I see teeth. I see both kidneys hanging down. I see a heart. Most people have 2 kidneys. Sometimes people can be born with 1 solid kidney. Sometimes there's something called a horseshoe kidney where they're actually still connected. Oh, there goes a bucket of nails. Oh. There's always a risk that you're going to get an infection because the skin itself has bacteria on it. So when you get cuts and punctures, you potentially can seed it deeper, so you can get further infection treated with simple antibiotics, plus or minus a tetanus shot. These rusty old nails. Nobody gets tetanus anymore because everybody gets the tetanus vaccine. Oh, it's gotta hurt. That's way too much force. Oh my gosh, it's gotta hurt. Leave it in or pull it out. This one is not a large impaled object. It's typically going into the soft tissue. So there's the potential likelihood that you can pull them out yourself. And then if you do find that it hits a major blood vessel or not in that area, 1 piece of small gauze, direct pressure right to the area that's causing the bleeding. Hold it for 10 to 15 minutes and the bleeding will potentially stop. If the impaled small object is not coming out easily, do not try to force it out because it could be stuck on something. You can cause more damage. What? Putting it back in, trying to hide them? Oh, that's not good. Oh my gosh. Yeah. Don't do that to a human being. There are times when like I've taken staples out of people where the angles are all weird from walking on it and stepping on it, and you just have to figure out the angle to get it out and it'll come right out. Oh, I love going to the movie theaters eating candy. Uh-oh. Flashbacks, he's back! No! Oh, what the? In terms of being stuck in a seat, could you actually like tear somebody apart? Unlikely. You have a lot of different connective tissue. Unless there's an open area where there's already like ripped tissue, could you potentially grab it and rip it more? Yes. I've had to put a lot of joints back together. It takes a lot of force. Oh my gosh! When you're basically cooking somebody's head, you're probably gonna have a hole in the front or wherever you're putting the flame to that's got 1st degree, 2nd degree, 3rd degree. It's gonna be 4th degree burn, probably burning all the underlying tissue, muscle, bone, nerves, all of that stuff. In real life, the brain is a lot more like uniform, but it has those funky gyri, which are those swiggles on the brain. It has this like fleshy kind of color and it's very, very soft. Could it actually heat up and pop like that? Obviously not. Whoa! When you're strangulating somebody, 2 different mechanisms are going on. One, you're decreasing blood flow to the brain, so that's going to make you pass out and decrease oxygen to the brain. And there's a potential of cutting off somebody's airway and causing all these other kind of further down the road processes. But typically when you actually knock somebody out, it's due to those combination of those 2 things. Oh, man! What the? The fact that the eye was actually still moving. In real life, if you die, could your eyeball still move a little bit? Potentially, yes, but only for a very short period of time. That's one of the things that we check for, having to do with if somebody's alive, is pupillary reflex and seeing if anything moves. That was it for Happy Tree Friends. I love this show. It's funny, it's a little grotesque, got a lot of medical things that I can talk about and I enjoy talking about. So let me know if you guys liked this video and you liked my react. You're gonna love this video, so check it out. And as always, make sure you subscribe, hit those bell notifications. Thank you so much for watching and stay healthy, my friends.